Hi, so I am in sunny Menorca on my holidays, but I have a few spare minutes, so I thought I'd answer some of your questions. And for those of you who don't know who I am, my name is Dr. Tasha, and I'm here to help you navigate the world of health in general and breast cancer specifically. Is it normal to get twinges of pain months or years after breast cancer surgery? Yes, it is. Unfortunately, it's not uncommon to still experience twinges of pain months or years after breast cancer surgery. And that applies to whether you've had a lumpectomy or a mastectomy with or without reconstruction. Patients normally complain of sharp shooting pains or a burning type of pain. It can also feel like electric shocks, and it happens intermittently. It doesn't have to happen all the time, but it may even wake you up at night, but not severe enough to need pain relief. The thing to help you with these symptoms are usually simple things like taking regular painkillers, and obviously if you're worried about it, do get them checked out. But it is not uncommon to experience intermittent twinges of pain months or years after surgery. It normally does get better with time. So next question is, can you still get a recurrence after a mastectomy? Unfortunately, yes, you can. And this applies to whether you've had a simple mastectomy and you've gone flat, or you've had a mastectomy with a reconstruction. At the time of a mastectomy, we leave about 5 to 10% of breast tissue behind because it's just impossible to remove 100% of breast tissue. And so there is always a risk of recurrence. The important thing is for you to be continually aware of what your chest wall feels like if you're flat, or what your reconstructed breast feels like if you've had a reconstruction. You need to look out for any nodules, any new lumps, any skin thickening, any contour change. Anything that is new, you must get them checked out, because unfortunately, yes, you can still get a recurrence after a mastectomy. I have been told I have fibroadenomas. Do I need to have them removed? A fibroadenoma is a benign lump, meaning it's non-cancerous, and we know that fibroadenomas do not turn into cancers, so we're very confident for them to be left alone. We don't need to operate on them, and we don't need to remove them. Fibroadenomas are the commonest cause of lumps in young women, and they do not need to be removed unless they are rapidly increasing in size, especially over a short period of time. Then they need to get checked out. But as a rule, they don't need to be removed. I have ductal carcinoma in situ, or DCIS. Do I need surgery? That's a really good question. DCIS, by virtue of its definition, is ductal carcinoma in situ or in situ. That means that it doesn't have the ability to invade or spread elsewhere. So if that's the case, then why do we need to remove it? And unfortunately, at the moment, we don't have enough knowledge to say what would happen should we leave DCIS alone. And at the moment, we treat it with surgery because of that lack of knowledge. There are 3 grades of DCIS, as you may know: low, intermediate, and high. And we've actually, in the UK, we have completed a trial that looked at what will happen should we not treat the low risk DCIS. So patients were randomized to surgery if they've had non-high risk DCIS versus no surgery, and it'll be really interesting to see the results of that trial. But at the moment, yes, DCIS doesn't invade other parts of the body, but we don't have enough confidence to leave it alone, and that is why we treat it with surgery. What are the signs that breast cancer has returned? Signs of breast cancer recurrence can vary depending on whether it has returned locally, regionally, or in distant sites. So locally, that means that it has recurred in the breast if you've had a lumpectomy, or along the skin or chest wall if you've had a mastectomy. And things to look out for are lumps, nodules, skin thickening, contour changes. Anything that's new, you need to get it checked out. Regional recurrence, that means looking at lymph nodes, usually underneath the armpit or in the around the clavicle area. Again, those signs that you need to look out for are lumps, or any lumps or bumps around those areas. So that could denote a regional recurrence. And then lastly, distant recurrence. That basically means that the cancer has spread beyond the primary site, i.e. beyond the breast. So the areas that it can go to are the lungs, the liver, bones and brain. And depending on where the cancer has spread to, it will dictate the symptoms that you may be experiencing. So for lung, it could be chest pain, shortness of breath. Liver, it could be jaundice, bloatiness, loss of appetite, weight loss. In the bones, it could be bone tenderness, bone pains that doesn't go away. And symptoms for brain metastases are neurological symptoms like unsteadiness on your feet, visual disturbances, nausea, headaches, things like that. So how can you tell whether breast cancer has spread? It depends on the site of metastasis. So I hope you've enjoyed this Q&A. As I said, if you have any other questions, leave them in the comment section. I'll see you in the next one. Take care.